and talking about the need for healthcare costs, the need to try to make sure these costs don't continue to skyrocket, because they are skyrocketing. National healthcare spending expected to reach about $2.5 trillion in 2009. By 2018, that's about 17% of GDP. By 2018, if we do nothing, it's going to double that. Okay, almost 4.4 trillion, more than double 2007 spending rather. Double it from 2007. We need to do something to curtail this excessive spending that we're doing, and this healthcare plan, I believe, does that. And this healthcare, economists have found that rising healthcare costs correlate with drops of healthcare insurance coverage. Your healthcare premiums, whatever you're paying now, just look at what you're paying now. We do nothing. By the time 2018 comes along, times it by 2, and that's what you'll be paying. I just read an article the other day, 10.5% increase in pharmaceutical drug costs, which is definitely going to impact senior citizens. And there is no cost of living adjustment for the Social Security benefits, so senior citizens are getting squeezed as it is already. So we have to do something to make sure we can settle this crisis and take it head on and be aggressive with it. So these are a few of the myths here that I found. And I wanted to just make sure that we talk about these things. I urge you to read the bill, read this legislation for yourself. Do what you can to make sure you're researching the bill, you're learning. You're not only listening to Fox, you're not only looking at MSNBC. You're reading, you're learning. Talk to people that have different opinions. Debate these individuals for yourself with a rational debate. Be agreeable as you disagree. And then I was on Facebook the other day, and I was talking to an individual, and she said to me that we were going back and forth, and she said that, I'm not for socialized medicine, and I'm not for this, and I'm not for this healthcare reform. And after a little bit of talking, she come to find out that she actually had an ailment, a physical ailment, and she was worried about that she wasn't going to be able to afford it. And as time went on, and so we talked about it further along, and I finally got through to her and said, this healthcare legislation is for you. If you're concerned about your costs, this legislation is being passed or trying to be pushed through on your benefit, for your behalf. So we have to understand that many individuals out there fighting, we are being fed, they're fighting against this healthcare reform, and they're being fed these talking points from individuals whose only special interests are out for the healthcare company that makes billions and billions and trillions of dollars off the backs of your poor health. The poorer health you are, the more money they make. The pharmaceutical industry, the healthcare industry, all around. They're looking out for their bottom line. They're not looking out for you. At the end of the day, we need to look out for ourselves and make sure that our government is held accountable to pass those things that are in the benefit for us, the American people. This is what we want. I'm here to fight every single day I can to get this information out there to as many people as possible. And lastly, Obama, this is to you. I love you. I support you. I voted for you. I campaigned for you. I trust you. I know you have the best interests at heart. At least I think you do. And my vote, I'm still 100% in your corner. But I have to say, I'm a little bit impatient about some of these things. And I know what you're doing. You're letting the kids play. They're out in the field. They're playing around, and the kids meeting the Congress and Senate and the Congress, and they're going back and forth, putting their bills together. And I know you got this big joint seminar or this talk coming up on Wednesday, but at the end of the day, you have no plan. You have no plan in which that's something in which we say this is what the president wants. We need you to be a leader. You are no longer a senator. You are the president. You are the one that needs to take control of this debate. Bring it back home and do what the American people voted you in there to do. We did not vote for you to have a bipartisan legislator. We voted for you because we wanted real, legitimate health care reform. That's what we want. I'm confident, and I'm trying to be as patient as possible, but I have to tell you, me with a lot of other folks, our patience is wearing very thin because it seems like you're trying to play the middle of the road. We didn't vote on you to play the vote for you to play the middle of the road. We voted for you to pass legislation and make sure that we can get health care reform. to get the public option on the table. That's what the American people want, and don't listen to the loud minority who's controlling the debate right now. I don't want to have these folks out here and out there in these wacko tea parties and doing and controlling the debate, and they're just the loud minority. We want you to control the debate. So hopefully we can bring it back home. The Congress is going to come back from recess, and we can take control back over this debate again. I'm confident you're going to be able to do it. And to the American people, I'm with you. I'm going to fight with you, whether you agree or disagree with me. Let's have a rational discussion to move forward as a country together. Thank you very much. My name is Ryan Mack. I'm president of Optimum Capital Management. Have a great day. I know that went way over 10 minutes.
Yeah, you got
30?
About 40 minutes.
40 minutes?
Yep.
Doggone.
About 40 minutes. But if you're gonna YouTube it, you just break it down.
Yeah, yeah. How was it?
It was fantastic. I mean, I'm an information junkie myself. I do political commentary.